in this informative and educational big talk by Dr. Roberta Garceau. She talks about how snoring is far more than just an annoying sleep habit and how it can be dangerous. Please enjoy this incredible big talk by Dr. Roberta Garceau. Snoring is no joke.
Who's ever slept or lived in close quarters with someone who snores? Or maybe it's you. You know what I'm talking about. Did you find it annoying, disruptive, amusing maybe? But were you ever alarmed that someone you care about had stopped breathing? The truth is, snoring is no joke. It's a sign that the person cannot breathe properly, that they may even be choking. I'm Dr. Roberta Garceau, diplomate with the American Board of Dental Sleep Medicine, and I'm here to share with you not only the frightening statistics surrounding snoring and apnea, but also how you can enhance every aspect of your life through simple adjustments to what happens while you sleep. Are you ready to feel more alive and possibly even save your own life? Did you know that on average, people breathe about 12 to 15 times per minute, and even healthy people can stop breathing a few times per hour while they sleep? But people with apnea stop 10, 20, 60 or more times per hour. That's every minute, sometimes without even realizing it. Humans can survive for weeks without food, days without water, but without breath and oxygen, the brain stops functioning in just a few minutes. Sleep disorders, including snoring and apnea, afflict an estimated 70 million Americans. That's 1 in every 5 of us. And of those, 80 to 90% go undiagnosed. If you're not breathing effectively during your sleeping life, your waking life is impacted. The way you interact with family and friends, your reaction time while driving, and the ability to function and think clearly throughout the day are all affected. What would happen during your waking life if you simply stop breathing for 10 seconds of every minute? Think about that for a moment. How could you eat and digest properly? How would you learn anything new? And how could you be present for an intimate relationship if you stop breathing every minute? Millions of Americans are suffering with untreated snoring and apnea, and the health ramifications include stress on the heart. This can manifest as coronary artery disease, high blood pressure, increased risks of stroke and heart attack, and arrhythmias like atrial fibrillation. Now, this is bad news when the result is premature death, but it's also bad news when the result is surviving with disabilities from the stroke, heart attack, and so forth. Since sleep disorders interrupt the natural sleep cycle, they also disrupt hormone levels. Cortisol dysregulation can cause or worsen issues with blood sugar control, leading to uncontrolled diabetes. And thyroid disorders are another common comorbidity. Obesity can be both a cause and effect of apnea. Carrying excess weight, especially around the neck or midsection, it's like trying to breathe while wearing a sandbag. Have you ever noticed that gaining weight can cause the feet or fingers to swell? Well, the same holds true for your tongue. When you gain weight, your tongue size can increase, causing an upper airway obstruction when it falls to the back of the throat while you sleep. Another underappreciated fact is that acid reflux often accompanies apnea. When the body senses that you're not breathing, the brain jumps in and shouts, "Breathe!" This causes the muscles of respiration to kick in with gusto and can propel stomach acid up into the mouth, irritating the throat and corroding the teeth and gums. You need quality sleep to process and heal the stresses of the day. Insufficient sleep contributes to mood disorders, depression, anxiety, ADD, ADHD, Alzheimer's, brain fog, not to mention the effects it has on your relationship with your bed partner, because in all likelihood, it affects their sleep as well. And apnea is linked to sexual dysfunction, loss of libido, and impotence. If you still think this is not such a big deal, let me introduce you to one of my patients. an otherwise normal, healthy weight woman in her 40s whose snoring prevented her from sleeping with her husband. To everyone's disappointment, the CPAP that was prescribed was not successful for her. Fortunately, there's other options. Once we fit her with a custom sleep appliance, basically a mouthpiece that guides the lower jaw and tongue forward to keep the airway open, kind of like the head tilt chin lift maneuver of CPR, she and her husband were able to sleep together for the first time in 20 years. If you don't think this can be life-changing, think again. Now, doctors who aren't trained to recognize sleep and breathing disorders may simply miss them. But the good news is you can screen yourself in 3 simple steps. 1. Do you snore? Snoring is either a sign of sleep apnea or a precursor to apnea. In either event, snoring is a red flag waving that you should be evaluated. 2. Stick out your tongue. Do you see the air hole and the dangle down uvula? Or do you mostly see your tongue and some tonsils or other big pink tissues back there? If you don't see an air hole, this is another red flag waving that you should be evaluated. 3. What's your medical history, including any medications you take? And do you have a family history, like a sibling or a parent with apnea? If you have a history of high blood pressure, coronary artery disease, stroke, AFib, diabetes, obesity, depression, anxiety, thyroid disease, attention deficit, and especially if you're taking 2 or more medications for these issues, this is a big, bold flag waving that you should be evaluated for sleep apnea. Okay, great. You've self-screened. Now what? It's time to find a sleep provider near you, or you can check out sleepeducation.org. Once evaluated and with a definitive diagnosis, you have choices for enhanced living through better breath. You may be familiar with a CPAP or some other kind of mask, but that's not the only option. Sometimes it's as easy as sleeping on your side, or using saline nose spray, or placing a small piece of medical tape on your lips to promote breathing through the nose. Perhaps you'd benefit from a dental sleep appliance, fabricated by a qualified dentist. Or you may be a candidate for surgery to correct a deviated septum, remove enlarged tonsils, or have an implant that stimulates your body to breathe. Just imagine what life could be like if we all had healthy sleep and breathing. It could be a world of improved quality of life, where people are kinder because they feel more rested. A place where people are more patient with each other, feeling better themselves for having had better sleep. Envision our society relying on fewer medications and medical interventions because we were all at a higher level of living and being. This may sound a bit utopian, but it's ours for the taking if we just have better rest. Our bodies were not designed to sleep 1/3 of our lifetimes for no reason whatsoever. Quality sleep and breathing are critical. Again, 3 screening questions. Do you snore? When you stick out your tongue, do you see an air hole? And do you have a medical history that increases the likelihood that you could have sleep apnea? Imagine feeling more rested, having more energy and focus throughout the day, and enjoying greater intimacy with your loved ones. You can experience your optimum health. It's possible for you and for those you care about. You may even save your own life.
If you love this big talk, I would love for you to share in the comments so that we can fully support you. Each one of these speakers flew to New York City to be on my stage for 2 days. This program is called the Big Talk Live. We do it twice a year. They come to the Triad Theater and we rehearse on day 1. And on day 2, we film your talk so that you walk away with a fully realized reel. And I would love to support you. All you have to do is head on over to triciabrouk.com and get more information. And for those of you who are watching, be sure to subscribe and hit that notification bell so you get access to our latest videos. I appreciate you being here with us. And remember, everybody, your voice matters. Big love. Mwah.